Hello, everyone. Good morning, good afternoon, good evening, wherever you're watching this from. I hope you guys are doing well. I just wanted to welcome you to my new channel. It's called Ask Renz MPH. Before we begin, I'll give you a brief introduction about myself. So, again, my name is Renz. I'm a first year Master of Public Health student at Michigan State University. And I recently graduated from the University of Toronto in 2023. So I did my honors Bachelor of Science degree there, and I specialized in global health, health studies, and psychology. I'm currently based in Manila, Philippines, MPH as well. That wasn't intentional. All right. Okay. So where did this idea come from? So I've always wanted to share my knowledge, and specifically my interest in public health, global health, the health sciences. And, I made this channel because I believe that education is a privilege. I'm privileged to be able to speak to you guys on these topics. I'm privileged to have this education, and I understand that not everyone has that same opportunity. So I'm all about equality, making sure that everyone has the same supports, everyone is treated equally, um, with respect and with kindness. But at the same time, I believe that everyone should have that opportunity. Sadly, that's not the case in many places, especially here in the Philippines. Um, but really, that's why I was really inspired to create this channel because I believe that I can do this and share the knowledge that I have with my interest in public health and the health sciences to actually reach a greater audience here online. And so, you know, for me, it's about sharing this knowledge, but at the same time, it's also about my personal journey, navigating my own journey as well. And finally, networking. Wherever you're watching from, you have your own background, you have your own journey as well. So I'm always interested in learning more about um, people's journeys, their experiences, what did they do, and where did that lead them in their current path, or what inspired them to pursue a certain career, right? I'm always interested in that, um, to learn more about that, and always welcome the opportunity to network. And I believe this is also an appropriate place to do that. Um, so before we begin, and I don't want to overwhelm you guys with a lot of information, but I'm just going to give you an overview of what you guys can expect from this channel. So really, my interest is in global health, and I've shared one of my favorite definitions on global health. It's a long definition. There's a lot of things here, but don't worry, we're going to unpack them. And even by the end of this video, if you're still unsure what global health is or some of these things that I've discussed, that's completely fine. We're still going to delve deeper into these topics in future videos and lectures. So I'm just going to read this definition, and I think I should have my laser pointer handy as well. Um, so global health is a field of study, research, and practice that places a priority of achieving equity in health for all people. Global health involves multiple disciplines within and beyond the health sciences. It is a synthesis of population-based prevention with individual level clinical care, promotes interdisciplinary collaboration, and emphasizes transnational issues, health issues, and determinants. So this is a definition that was created by Copeland et al. And his colleagues. And this is was during the Consortium of Universities for Global Health. This was their executive board. Um, so there was a lot that I mentioned there, probably, just flew in to one ear and out the other. But I want to unpack a lot of what was mentioned in this definition. I don't want to overwhelm you guys all at once, but that's why I want to unpack this, just so you guys can get, a general understanding of what I'm talking about when it comes to global health. So global health it was mentioned before, it's a field of study, research, and practice focused on improving health and achieving equity in health for all people. The second part of it was that it involves multiple disciplines, both within and beyond the health sciences. Third, it combines population-based prevention with individual clinical care. And fourth, it promotes interdisciplinary collaboration. Okay. Finally, at the heart of global health, it actually addresses transnational health issues and determinants. So there's just about 5 points here, and I'm going to go through that. So really the heart of global health is equity, right? And so what do I mean by equity? So it's about ensuring equal access to healthcare and health opportunities, right? For all individuals around the world. Okay. You might be in the United States right now, you might be in Asia, right? Um, and you can have these two different mindsets about what healthcare is. Is healthcare a commodity? Is healthcare based on human rights? Is health a human right? Um, or is it something that you need to have resources for in order to access? Okay. So, and I understand that everyone will have different experiences with healthcare, and feel free to always pop that in the chat if you want to share um, any types of experiences with healthcare, whether positive or negative. Um, and so equity really reduces health disparities, and this is across the board, across different populations, as I've mentioned. So, um, you can be in South Africa, you can be in the Philippines, you can be in Canada, you can be in the United States, but wherever you are, when we talk about equity in global health, really the goal is to reduce health disparities, right, across different populations. And so disparities are when you have unequal experiences when it comes to health, um, unequal health outcomes. Why is a certain population dying at a faster rate or contracting a disease at a faster rate compared to another population, right? So you can just think about maybe some of these examples that you've seen in the news and in the media about um, these types of scenarios. And really, the focus of global health is really on marginalized and underserved communities. So these are communities that are usually disproportionately affected, right? So there are those communities that may not um, always be understood. These are communities that can be stigmatized as well. And essentially, these are communities that might not get the same health supports as a general and wider global population. So really, that's what is at the heart of global health. Really focusing on those who might not be seen. Okay. Okay. So global health really requires a multidisciplinary approach. All right. And what do I mean by multidisciplinary approach? So it has to integrate medical, social, economic, and political perspectives, right? It's all in one. And this can include experts from medicine and public health, when you have doctors working in primary level care facilities, providing one-on-one patient care, or as we've seen in the pandemic, the COVID-19 pandemic, how we've had epidemiologists and disease trackers working to, create statistical models on the progression and speed of the disease, and infection rates. So, it can include both sides of medicine and public health. Global health can also include areas from the social sciences, so anthropologists and sociologists. A notable anthropologist is the late Dr. Paul Farmer, who founded Partners in Health. And it's really, again, taking this multidisciplinary global health approach. Um, and he championed health equity. Um, and really, his foundation was that um, a lot of his work was centered around the term that he coined structural violence. And so why do we have these structural factors that lead to adverse health outcomes? So it's essentially structural violence, why people have these disproportionate health outcomes as a result of violence in the structures. So Paul Farmer was I think he is the most widely known anthropologist in global health. Global health also integrates economics and policy. So policymakers, those that um, are actually drafting legislations, passing, even small statutes or bills. And it can also include health economists who predict um, budgeting, financing healthcare. So a lot of these things. And finally, technology and data science can also be another discipline. And as we know, with the rising cases of artificial intelligence in healthcare, and really, since artificial intelligence is a relatively new field, we don't know a lot about it, but it's quickly evolving and quickly developing. We can address AI, artificial intelligence in healthcare, and maybe some ethical issues with that, and some benefits and possible concerns. And at the same time, health informatics is something that we can use um, to inform us of these indicators that we see that are causing inequities in global health. And so the information. So a lot of these, again, are many different disciplines. You might think that people are working individually in their own silos, but there's a lot of behind the scenes collaboration that goes on in public health and global health. And in terms of global health, we can think about the definition mentioning population-based care versus individual level care. And we can again think of the example of the physician who is providing one-on-one care and support for his or her patients. That's more of an individual level of care. However, public health takes more of a population-based approach. However, it's not just the wider population, because public health collaborates with these different disciplines. So it it can actually go from the population level to the individual level of care. And so an example that I can give you is that public health is really about prevention strategies. And you might have heard the quote, an ounce of prevention is worth more than a pound of cure. So public health is all about prevention. So even though we're talking about population-based scenarios, which are thinking about the wider population, the global population within a nation or within a state, um, these can translate to the individual level. For example, vaccination campaigns, vaccination strategies um, that individuals can either choose to participate in or may not participate in. And we've seen that during the COVID-19 pandemic, a lot of vaccine hesitancy or anti-vaccination efforts. So, but again, at the heart of public health is prevention strategies. How can we translate population-based efforts to the individual? And so that takes a lot of health behaviors health promotion and health education, right, to address these behaviors. Why are some people not getting vaccinated? And that's not always an easy answer, or not always an easy question to answer. But, and that's where public health comes in. And we also have sanitation programs that are in a lot of low and middle income countries as well. So just thinking about the health of the wider population. And in terms of clinical care, again, when we're thinking about physicians, they're focused on the treatment of diseases and really centered around that individual patient that they're working with, whether they're a family doctor, a psychologist, a psychiatrist. Um, we're working on an individual level with patients. All right. And again, we can really distinguish and differentiate between prevention and the treatment approach of public health and clinical medicine. However, I believe they really work hand in hand together. They're interrelated. Um, and really the goal of global public health is to really balance these interventions with individual medical treatment. So, and this is what I was saying earlier. When we're able to translate population level efforts into individual treatment um, and individual interventions, we can actually avoid medical treatment, right? So it's better to, as I mentioned earlier, an ounce of prevention is better than a pound of cure. So it's better to actually have prevention strategies before we have treatment. So this is for public health of people. Treatment is really the last option. Treatment should be the last option. So really we're focusing on prevention. Okay. And another part of the definition is interdisciplinary collaboration. So this really encourages cooperation and, as I mentioned before, collaboration among various fields to address health challenges. So again, examples of this are doctors and public health officials working, especially during the COVID-19 pandemic, where they were really working on disease prevention strategies. We've had government officials, public health officials really collaborating with advice and sometimes conflicting advice, even on a national political stage, as we've seen in the United States. Um, but there is collaboration involved. Also with researchers and policymakers, you know, during the COVID-19 pandemic, they had to translate evidence-based policies um, when in terms of implementing stay-at-home orders, right? Mask wearing. They had to translate the evidence quickly in a short period of time just to be able to implement these policies, whether it's with COVID-19 mandates, stay-at-home mandates for mask and social distancing orders, or on the researcher sides, those who are actually working to develop these vaccines. There was a lot of collaboration involved with the private and the public sector, especially a lot of funding that needed um, to be provided in order for the COVID-19 pandemic to be stopped in the first place, right? So, and in terms of the role of NGOs and governments, we have global health programs, but and non-governmental organizations that are working on global health around the world. However, as we've seen in the US political stage, how a lot of funding cuts have been initiated for those that are actually providing um, aid, international aid. For instance, the US aid, that was completely scrapped. A lot of funding as well that's being removed from um, research institutes like the National Institutes of Health in the US. So, um, and and really, this is really a transnational issue. And we can think about these types of determinants. So what's actually causing the spread of diseases? Because a disease is not limited by borders. You can't tell SARS-CoV-2 or the pathogen that causes COVID-19 to stay in its source, wherever it's coming from. In China, you can't tell that virus to stay there. It's going to make its way around the world. We can't stop that. And so that's really the emphasis of global health because it's a transnational health issue. It crosses borders, these health challenges, and it really requires international cooperation, right? On all sides. We've seen the good and the bad during the COVID-19 pandemic as well, but um, still, this is at the heart of global health, right? So again, infectious diseases like COVID-19, tuberculosis, malaria, but there's also things like non-communicable diseases that are a health burden to many countries in the world, like diabetes and heart disease. And this is where the determinants comes in to play, right? Because we need to consider the social and environmental determinants, things like climate change, poverty, education. How do these things impact health outcomes for different types of individuals? And in a future video, we'll be exploring what the social determinants of health is. So stay tuned for that. Okay, and finally, why does global health matter? Global health takes a holistic approach. So we're looking at health as a whole, not just for the whole society, but when we look at an individual, we look at them holistically, right? Everything that's going on in their lives, not just the physical, but also the social, the mental, psychological well-being. We look at all of these things. We take a holistic approach to health, and this needs to integrate equity, prevention, clinical care, collaboration, and policy, which I've discussed in the previous slides. It requires cooperation across countries, different disciplines and sectors. And this really helps us build a healthier and more just world for all. And these are one of my favorite diagrams to actually explain what equality and equity is. Of course, we want to have equal health outcomes, equal positive health outcomes for all individuals around the world. However, the understanding of equity is that not everyone has the same supports. Not everyone can reach above the fence. So when we're looking at these three individuals, we can think of them as family members. This is the father and two of his sons. One is probably a young age, but he's very short. And you can see that they're not able to see, well, this little guy, this cute little fellow, is not able to see across the fence. And that's a problem, right? He can't see the game. He can't see this baseball game that's going on. But how do we translate this into health equity that we've been discussing with the definition? And you can see when we're only focusing on an equality approach, we're giving everyone the same thing, the same supports. And that's what leads to disproportionate health outcomes. Not everyone is able to see across this fence to see this baseball game, but in health, that translates to not everyone has the same access to care, right? Not everyone is getting the same health outcomes, positive health outcomes. Some are suffering, right? Like this little guy here. And then some people are getting more than their fair share, right? And there's some people that are just getting, just enough, the bare minimum, just to be able to see. And in healthcare, we can think of this as like a ladder, right? We can think of the wealthy here and the poor, the marginalized here at the bottom. They're at the bottom of the ladder. They don't have the same supports that the people on the top have, right? When we're only focusing on equality, that means that we're giving everyone the same supports. So that's why we should take a health equity approach, which, going back to that definition, is really at the heart of global health. we're giving support on a case specific basis, just so people are able to see, everyone's getting enough, and you see how their heads are aligned here. Everyone, all three of these individuals are getting support that's just enough for them to make the minimum, right? The best health outcome, right? And in this case, they're all able to see the baseball game now. And you see that these cartons, these boxes, these crates, we've taken this guy's crate out and we put it on this guy. And now he's able to see. This guy was already able to see with one crate, right? But you see how earlier this guy had a crate, and he was able to see even more. Whereas we have this little guy, he can't even see at all. So that's the thing. If we're all always giving the same supports for everyone, without regarding who they are and their characteristics, we're creating an unjust society, right? Because some people have more supports, more than enough supports, whereas some people don't even have any supports, or the supports that they have are lacking, they're insufficient, and they can't even do anything with that. So equity, as opposed to equality, is about giving them exactly the supports that they need in order to um, see, to be able to get these health outcomes, access to care, right? And it's the understanding that everyone's different, everyone has different experiences, um, everyone has a different status. And when I gave that example before on wealth, um, we can have so many people who are wealthy, billionaires. Look at the White House right now in the United States. But we can also think of those who are living homeless, below the poverty line. So it's like, it's a tale of two cities. There's two worlds here that we need to think about when we're talking about equity. There's people with too much on their hands, and there's people without anything, or, a very, very small amount that can't even allow them to see above this fence or to get that health outcomes that we as public health officials desire. And so this is really why an equity approach is important, right? To address these inequities, these disparities in health. And so I've just included a chart here with nodes, and you can pause the slide. Not going to go into everything here, but just to give you an overview of what health studies is, that's a part of my program when I did my undergrad. Health studies really is an interdisciplinary approach. And, as we've talked about this definition already with global health, it's interdisciplinary in nature. And so that means bringing all of these different disciplines together in the field of health studies to actually explain public and global health, right? And so, we can have biostatistics, which is essentially statistics applied to public health, um, to actually explain disease outcomes, infections, and, all of these numbers, really founded by principles of epidemiology. But we can also describe things like our environment, environmental psychology, which talks about things that influence our psychology in our environment, in our built environment. And so it's not just about medicine, it's about all of these different factors, even health policies, um, that that are actually legislated in our territories. So, for instance, seatbelt use, um, that's a health policy, because those mandates protect people from car crash fatalities, right? So it's about bridging all of these disciplines together. And we can break down global health even further, when we have this multidisciplinary approach, and interdisciplinary collaboration. We can break that, so that we can also see how equity plays a role in global health, how population and individual care plays a role, as well as these transnational health issues. So global health really transcends all of these boundaries. It requires a multidisciplinary approach, collaboration between different disciplines, encourages teamwork, right? in order to address these transnational health issues and global health challenges across these boundaries, right? And it's really trying to bridge population-based care with individual level care. So again, we're thinking about um, public health official and the doctor collaborating, right? And really, this is with the goal of reducing the health disparities worldwide. And again, centered around equity, right? Health equity, like that diagram I've showed previously with defense. And so what can you expect? So in this series, this channel that I've made this little acronym. This is all of the topics that I want to um, uncover in this channel, but as well as opportunities that I want to open, not not just for myself, obviously, but for everyone who's watching. But we're going to learn about health. So this is a Harmony acronym I made. We're going to learn about health, what it is. So health as a whole. But we're going to also learn about advocacy. So what can you do to empower your local communities? You may be living in a community right now um, that's disproportionately affected. You have populations that are disproportionately affected by different health outcomes, right? You might be living, or you might be part of a marginalized community, right? So how can you advocate for your health impacts that your community faces, right? Or you yourself as an individual? And also, I want to emphasize research. While I share a lot of knowledge, a lot of ideas, a lot of terms, it's really important for research to be a two-way street. So when I'm doing research, I'm sharing knowledge, and that's based on my own research and understanding. But for you guys, when you're doing your own research, it's also important, right? For you to actually extend beyond these lecture videos and actually do your own research, so that you can actually validate what I'm sharing. I don't know everything, right? So it's always important to do your own research in everything that you do, like in your work, whether you're working in health, in public health, or in any other discipline. Research is always important because research is also a collaborative effort. We all need to work together with research. And so if you have something to share, something you thought about during this video, feel free to comment that below. And for the M in Harmony, I also wanted mentorship to be a part of this channel. So, in the future, eventually, I hope to have volunteers, myself included, to provide mentorship for those who may be looking at a career in public health, who may be, in high school or just about to graduate and don't know what public health is. And, we can have these mentorship opportunities and try to connect individuals with people in the field already. So, it's all about networking, right? And mentorship. And really, I wanted to emphasize the N and the Y in Harmony, our next gen youth, right? Our next generation of youth. How can we empower these communities, this population, right? This cohort of people to actually be involved in public health. As we've seen in the COVID-19 pandemic, public health is already a growing field. However, there are a lot of people who are dismayed, and actually some people who are actually deterred from pursuing a field in public health, given what's currently happening, especially in the United States right now. So, there's a lot of things that I want to address, and really, I want to tailor a lot of these videos, especially for our youth. It's really important that we share what public health is so that people can actually be interested and excited about this growing field, because it's a very, very essential field and not a lot of people know about it because a lot of times public health officials are working behind the scenes. And so I think it's time to change the overall narrative to our children that it's not only doctors, lawyers, and engineers that we that would be noble jobs to or noble professions to pursue, right? But public health is also a noble profession, It's a respected profession. You just need to know more about it. And so let me know if you guys are interested in these opportunities. I want to hear your feedback and really engage with you guys, my audience. And I wanted to stress that everyone here is welcome, right? Whatever your race may be, wherever you're living, your location, whatever you identify as, your social, cultural identity, your status, you may be a refugee, you may be a migrant, you might be an undocumented immigrant or a citizen. It doesn't matter. You are free to watch this, and I'm no way trying to put any political ideologies here on the table. I try to avoid that. I think it creates a lot of tension and stress, and I like to emphasize bipartisanship. Because at the end of the day, when we look at the core, we're all human, and public health is for everyone, right? It doesn't discriminate. So really, this is for everyone. Everyone is welcome. And what's next? What can you expect from future episodes? So I hope to do some episodes on current events in global health and public health, specifically what's going on right now in the United States, as you may heard in the news. I'll kind of explore that in a global health lens. And then I'll introduce you guys to the social determinants of health, which we've already briefly touched upon in this video, but we're going to delve deeper into this topic. And finally, I'm going to introduce you guys to a new discipline, a relatively new discipline called planetary health. So think about what we've learned so far: public health, global health. What about planetary health? What do you think that might be? So stay tuned for these future episodes. And obviously, there's going to be more ideas, and hoping to get a lot of your feedback on what other videos you guys might be interested in me doing. And again, if you guys have any questions or future ideas, again, leave a comment below. Feel free to leave a comment below. And if you want to connect with me, if you're a student, a teacher, professor, um, feel free to send me an email. This is my email. Just send an email my way. And again, I really welcome ideas and opportunities, even for myself, ways that I can improve the channel. I'm all about accessibility and want to make sure that everyone is learning, and no one's excluded. So I try to incorporate visual elements as well. And obviously, since I'm talking, auditory, um, I try to incorporate all of those senses when I'm trying to teach something, just so the point can be clarified and it's clear. So, and yeah, so that's the end of my presentation. I want this channel to grow, so please spread the word. Share this with your friends, or if you're currently an MPH student or a recent MPH graduate, um, feel free to reach out to me. And if you want to do some videos or collaborations, even we could even have an interview session. Um, I'm open, let me know. And yeah, thank you for watching and stay tuned for the next video. Thank you guys. Take care.